I'm Shannon Berg, and welcome to the Communicators Lab. On this video cast, I talk with, yes, interesting people who know things and have insights that can help you be a better business communicator. And today, first of all, it's Friday, so it's a great day. But on top of that, I'm talking with Lisa Goren. Lisa, you are the Vice President of Organizational Effectiveness and Learning at Legacy Health. And thank you for being with me today and chatting.
It's my pleasure. I mean, that intro, interesting people who know stuff. I'm curious about these people, but I'm
glad. Who are these people?
It's Friday, so I'm glad that maybe our bar is a little lower for a Friday on the interesting and we'll see how it goes.
Yeah, we'll see. We'll see. And if it's good, then, we'll use it. And if not, no big deal. So, okay, Lisa, tell us what you do aside from comedy, which you do so well, but you actually do have a job in organizational effectiveness and learning that I think is fascinating and is so connected to communications, internal communications. So what do you do at Legacy Health?
So at our health system, which is 14,000 people strong, plus another couple thousand independent providers, we have 8 hospitals, we have hundreds of outpatient facilities, a lab, research, et cetera. And so, yes, I'm in human resources. I oversee a team that I consider the head, heart, and soul of the organization. So the head being a team of performance excellence engineers, folks who are schooled and trained in Lean and Six Sigma. They study kind of work processes, and they ensure that our patient experience and our customer experience isn't dependent on who shows up for work that day. Similar to getting on an airplane, you don't want too much variation in what's happening in the cockpit. That's what a good portion of my team focuses on. Another portion of my team focuses on interweaving the culture, developing our leaders and our teams across the system, and also helping all 14,000 of our team members manage change, which is rampant throughout the healthcare industry. Pandemic aside, we're an ever-changing and complex industry. So my team really is about supporting the folks at the front line who are in turn supporting our communities and our patients.
And I totally agree that this is the heart and soul of an organization because it's people. And we know now that that's everything. That's your culture, that's your productivity, and how you care for people, how you attract and retain the best talent in the market. That has everything to do with your future. It has everything to do with who you are. It is the most important work. So I love what you do, but you're also an accidental communicator because you oversee internal communications. And that's not uncommon that internal communications would reside in the human resources function because it is so closely connected to all of those things. So that's not always been the case. You've not always been a communications leader. So what has surprised you, or what have you learned about that part of what I would call the public relations profession? But what have you learned, and what has surprised you about that?
I've learned and been surprised at every turn. I think that when we think about communication, so much of it is thinking, well, I sent an email, so I communicated. That's obviously not the case. And it's really hard to do that, particularly in an organization where probably 1,000 people sit at desks with computers, but the other 13,000 are out interfacing and interacting with our patients and with our community members. So it's a difficult endeavor because you don't have folks who are just waiting to hear from you. Another key component of this, with this particular kind of undesked workforce, is they don't come together very often. So there's certain times of the day when you have their undivided attention. That would be, at a shift change. So at the morning huddle, when they're seeing who their patients are for the day on an inpatient unit or in one of our clinics, or frankly, another time of day when we have a captive audience. Is usually when they're on a break or in the bathroom. So there are a fair amount of flyers inside of bathroom stalls in healthcare facilities and otherwise. The most effective way to communicate internally has nothing to do with technology. It has nothing to do with flyers or even phones, although that's a great way to keep people connected. It's really about conversations. The conversation that a leader has or a peer has with somebody on the team is still the best way to help people feel connected, to help them feel like they belong, to help them orient themselves within a very complex industry and a very complex and large organization. What we want to make sure is that our folks can deliver the best care possible and do their jobs with little disruption, but also have the information they need in order to do that.
Yeah, this is so true. And it's such a common universal challenge that companies who have undesk workers face. Every manufacturing company that I've worked with, we've wrestled and turned over this problem of how do you reach and engage the front lines and people who aren't sitting at a computer. But that's really an old-fashioned, you said it, an old-fashioned view of communications. Communications is information received, not information sent. And I think too often people think, well, I pushed something out, or I sent this message, or we delivered something to people, and so we have communicated. But we know it's so much more than that. It really is a relationship, and those employee and manager relationships in particular, and that's what makes information come alive and become a part of somebody's, culture and how they think about their mission, the mission and the work and their belonging. So this is why I focus so much on training too, because a lot of times I come in as a communications advisor and people want the right words, and the right words are important, but taking those words and helping equip somebody like a manager to take that information, internalize it, make it come alive, and be able to carry that forward and do the same for their employees. Like, that's where the magic is as communicators.
And I'm glad you brought up training. I've taught quite a few communication classes in my career, and I would often ask people, show of hands, how many people have taken a communication class, and how many, and besides the required public speaking class you had to take in college, most people didn't have to take one. Yet from a very early age, we tell our kids to listen, but we don't teach them how. And so I think communications gets really overlooked, both as a profession, but also as a complex endeavor. Yet if you ask people where their biggest challenges are as leaders or in relationship, it's usually with communication. The good news is we know there are best practices. We know there are things that people like you can teach others to do to make it work better. But it's more complicated than any of us likes to imagine, because it's something we're doing all day long.